Here is something that should terrify you. Testosterone levels in young men in their prime, ages 15 to 39, have plummeted by 25% in just 16 years. We're talking about a drop from 605 to 451 nanograms per deciliter between 1999 and 2016. And ladies, we are not off the hook. Your testosterone drops by over a quarter in just one decade of midlife. It's not just about sex drive, though. It's about your vitality, your relationships, and frankly, the quality of your life. So let's talk about what's really going on. Hi, everyone. I'm Dr. Tara Scott, your hormone guru. And today in this live, we are going to be diving into one of the most misunderstood relationships. So if you are just tuning in to live today, we're starting out by talking about testosterone and libido. Now, I know what you guys are thinking, that testosterone is just for men. Well, it's not just a guy thing, right? It is also very important for women as well. And this hormone, testosterone, is absolutely critical for not just men, but also women. I'm talking about testosterone for those of you that are just tuning in. So what you need to understand is, how does it work with your libido? How does it transform your life, your energy? And yes, it also has to do with what's going on in the bedroom. So here's the problem. There's a lot of misinformation out there about testosterone and libido, and these myths are running wild. So the first thing my patients think of that testosterone is only a male hormone, but that's not true because it's also important for women. Our testosterone comes from not so much the ovaries as much as peripheral conversion in your muscle and fat from the adrenal gland. So it's not just about mood. It's not just about libido is what we think, and sex drive and sexual function and your libido, and it has to do with a lot of things. So libido is also for women influenced by hormones, psychological factors, stress, relationship, family of origin, what you're thinking about libido and sex and how you were brought up, and did you have any trauma? I mean, there's so many things that really do it. And here's the thing, I've seen patients with normal testosterone levels who have no libido. So it's not always the testosterone level that affects your libido. And there's others that have low levels of testosterone and have normal libido, or normal libido and low levels of testosterone, and vice versa. So it's a very complex web. And the other thing is that people still I'm still getting told by people that they went and asked for testosterone. One patient told me that their provider told them that testosterone would cause cancer. That's what I heard last week when I saw a patient. And they think it's dangerous because of the misuse. Now, testosterone is regulated like a narcotic, right? I have to have my DEA number to write a prescription for testosterone. You can only write 6 months. You have to see a patient. There's certain things, but it drives me crazy when we're told that, first of all, that it causes cancer. That I still had a patient last week tell me that, right? So when it's monitored, when it's prescribed properly, we can give testosterone to women. Is it off-label? Potentially. Does that mean we can't do it? So we can talk about a lot of other questions, but I just wanted to start with that one little bit. I see some questions coming in, which I'm going to get to, but thanks for the use of joining my rant on testosterone. So Louise wants to know, does weight loss injection help with endometriosis? So that is a great question. So the weight loss injections, we're talking about semaglutide and tirzepatide in general in your body are decreasing inflammation. And in the way that they decrease insulin causes inflammation. So I don't know, Louise, if that's actually been studied on whether or not actually weight loss injections help endometriosis, but my guess is it does help pain, it helps joint aches, and I think that there's a possibility that. Hello, Joe Magnet. Thanks for joining. And thanks for tuning in. I just started the live about testosterone, clearing up some myths that no, it's not just for men. There is a rule for women, and that seems to be a topic after the FDA hearing on available options for women. So super excited about what's coming down the pipeline. But one of the things that I noticed when I was teaching is that the normal testosterone level for women used to be 16 to 55 at our quest. Well, they changed the normal range to 2 to 45. That means what used to be at an abnormal level, 15, 2 to 15, is now considered normal. So if your doctor isn't trained, they don't know that your testosterone level is low, and they don't know how to write it, how to prescribe it, where to get it, or anything. So this is still one of the things that I am kind of on my soapbox again. For those of you that are joining in, let me know where you're joining from. Let me know if there's anyone out there that this is your first time getting on one of my lives. It is Tuesday at 7 p.m. Eastern. I'm usually live for the next 30 minutes to ask your questions. Joe Magnet, thanks for coming from Dallas. Hi, Tammy R. Thanks for joining. I'm here to educate you guys, to advocate for you guys. Oh, Joe, you're a newbie. Oh, thank you for joining. Oh, Cassie, also Indiana, your first time. For those of you that don't know me then, let me reintroduce me. I am a traditionally trained OBGYN. Dr. Tara. Oh, Louise from the UK. Excellent. I am a traditionally trained OBGYN, and in the last 22 years, I have been in the women's health hormone space. I'm a certified menopause practitioner and triple boarded in OB and in integrative medicine and also functional medicine. So I stopped delivering babies about 10 years ago, not quite 10 years ago, stopped doing GYN, and I focused on women's health because there was such a need. So I'm here today to advocate for you guys, to hopefully educate for you guys and validate what you're going through. So I usually come on Tuesdays, 7 p.m. Eastern for those of you that are newbies. Unless I'm traveling. Now, next Tuesday, I will be on a plane to Australia to educate the doctors there. For the last, 10 years or so, I've been going to Australia to teach the doctors there. So I will be en route and not be able to be doing live. So I definitely didn't want to miss it this week because I've had a lot of other conferences. So I'm here to answer questions. I'm a doctor, but not your doctor. So I can't really give medical advice, but I would love to be able to point you in the right direction or make sense of something that you've been told or clear up any myths or anything like that. So I'll be here for the next 20 plus minutes or so. So if you guys have any burning questions about hormone therapy, Joe, I do not practice in Texas. I am with a larger network, Forum Health, and I know they have several locations in Texas. I think they might go by Hormones by Design. So those are my colleagues. Those are not my practices, but I knew there's a place where they do hormone therapy and see women. Jacinda, both of my ureters were cut during. Oh no, Jacinda, I'm so sorry. I hope you're doing okay. That is not very common. When we do hysterectomies right after a C-section, it's a little bit more common because the uterus is really big from just giving birth and having a pregnancy. A lot depends on your anatomy. It is a known risk of the procedure, injury to the ureter, but it's more like the 1% frequency. So it's not that common that both of them are. I don't know. But if it was an emergency, and especially if it was an emergency because you were bleeding, I hope you're doing okay and feeling okay, Jacinda. And I wish you the best recovery. And whatever it wasn't found until 17 days later. Oh my gosh, I'm so sorry that you're going through this. So we'll definitely be sending you love and prayers for your recovery, Jacinda. It does sound like it's a long road, and thank God that after 17 days later they found it. I just hope that you're doing okay.